I'm Dr. Lisa Bryn, and today I want to discuss with you trigger finger, cysts, and stenosing tenosynovitis, which can be quite a bit to discuss since they're such big terms, but don't let the anatomy scare you. Often a symptom of tendonitis has progressed so far that we can now get little tiny lumps on the pulley tendons of our fingers. And sometimes those little lumps actually live on the tendon itself. So if you're starting to get little bumps, or if trigger finger or stenosing tenosynovitis runs in your family, this is the perfect episode for you to pay attention to. Before I begin, I just want to give you a little invitation to my finger-specific seminar that's coming up this weekend that is actually a spotlight seminar on flexor tendons, pulleys, and all things fingers. I cover layer by layer the different injuries that you see underneath the skin, over the flexor tendon, between the flexor tendons, and then along the flexor tendon and the bone. We cover friction syndromes, we cover loading syndromes and acute injuries, and how to diagnose which injury that you might have. Each injury has its very own traits. So when we document the hallmarks of each injury and we start comparing with the symptoms that we currently have, that's how we can really define what type of an injury you're likely to have. And also, without constantly testing that injury, we can give you a good treatment plan and help it to heal faster. So it all starts with diagnosis, and that's what this seminar is all about. I'm putting it out there as a workshop that is 100% fundraising for the Marshall Fires. So you can go to my website, Climbing Injuries Solved. If you go and hover over the Learn with Lisa button, there is a link that actually drops you into my Injury Spotlight course that you can click on the drop-down menu. And it also appears on my main page. This lecture comes to you with a special link that allows you to either view it on a phone, an iPad, or your computer. And if you can't make the time, don't worry, because I've got your back. I actually have it set up so that it's going to record it for you and give you all the good information you need to go through at your own pace at a time that works for you. This is a 100% fundraiser for Marshall Fires, and my goal is to try to help out friends and climbing buddies, and even my doctor that I worked with out of Boulder. His office got burnt pretty good around the edges, so there's a lot of people affected with that. So, okay, back to today's show. Trigger finger, also known as Stenosing Tenosynovitis, can present much like a regular cyst. However, these little balls of tissue that are in there are located within the sheath of the fibrous layer that overlays our flexor tendons, which includes the pulley tendons, right? That's a buildup of the fibrous sheath that covers our flexor tendons themselves. So it could be genetic, or you might have used this finger quite a bit. It's very interesting that the clients that I have that have this situation also have it on their most commonly used finger. So it's very fascinating that the more you use it, the more likely you are to have it, which just leads us to wanting you, as a recommendation, to use as many fingers as you can climbing and not just to stick with your favorite go-to finger. That also goes to every single component of your life, right? Clicking on that phone, typing on that keyboard, making sure that you are using all of your fingers and trying to be kind to them so that we are not setting ourselves up for injury at work or at home and then noticing it when you're actually on the climbing wall. Where did it come from? It may be completely not climbing related. So if we can pick through those things, that would be very helpful to us. There are two types of trigger finger that I have seen clinically. One is the genetic type, where you guys actually have more scar tissue laid down from an inflammatory response of your bodies. Other people I've seen are pretty much asymptomatic until they put a lot of tension through their finger, and the two flexor tendons actually have a friction point where they rub right under A2, and I've seen that when there's a lot of load going into our flexor tendons from climbing, that we tend to get rubbing, grinding, or clicking in this area. And that's where flexor digitorum superficialis, that bends all over fingers, splits in two and anchors onto the bone. Right where it anchors, splits like a snake tongue, where it splits is where it starts to rub on our flexor digitorum profundus, or our crimping tip-specific finger, when there's a lot of tension through there. So clinically, the two different things that we see, we treat them from different directions. As for, is it an inflammatory thing, or is it something that there's a tightness response to it? Okay, so there's a whole rainbow as for where you're coming from with this, and you can present as to you only feel it when there's a lot of inflammation and very irritated, or you could be that person on the other end of the spectrum that has it all the time. So it's usually located between the space of the tendon and the sheath is where we start to get scar tissue that accumulates. And this little bump is irritated and produced, at least in my case, by local trauma caused by factors such as consistent friction, dehydration, and or vibrational overload. To give an example of an acquired lump and bump, my case is that I was mountain biking downhill, a lot of vibrational load into my fingers, and that caused that tendon, which could have been already set up genetically, to form a little bump on it, which was mostly inflammation around some scar tissue. So just too much plain overuse all at once can cause or create a reactivation of Stenosing Tenosynovitis. These little bumps can shrink down to nothing if we treat them correctly. We don't expect them to go all the way away, but we do expect for them to get back to non-tender and non-painful. But I have some very specific tricks and tasks for you in my step-by-step process I'm going to lay out today so that we can keep these guys at bay. So the difference, before we hit my step-by-step, the difference I want to discuss between cysts and Stenosing Tenosynovitis, there's quite a bit of some difference there. Cysts are more of a hard nodule of fibrous material. Trigger finger and Stenosing Tenosynovitis are synonymous for this condition, in which the base of the finger is painful and possibly losing its flexibility. Nodules are present in some, but not all cases, and the result of a buildup on the tendon itself. Trigger finger is much different from an average cyst. So cysts, when you push on them, you feel them in one location. They do not overlap the tendon specifically. For the Stenosing Tenosynovitis, they are very local, that they're either on the sheath over the tendon or they're on the tendon itself. So if you touch your bump and you wiggle your finger, one question is, does that bump move around? If it's moving, it is actually located on the tendon. But if it stays in one place and doesn't move when you wiggle your finger, then it is either on your pulley, like mine is located on my A2 pulley, or it could be that it is a cyst and located superficially on the skin over that area and not actually involved in the tendon and the synovial sheath or over the top of that. So that's where the difference lies in those. My own little bump that I have caused one summer by cycling. 2 years later, I got it under control, but it very much is a maintenance thing. Like I said previously, we cannot get rid of these bumps. They are acquired scar tissue. They will decrease in size once we get the inflammation out of them. However, the scar tissue that we have acquired is now there for the long term. And so it's more of a management and trying not to flare that back up again. Some of you guys, you irritate them and they never talk to you again. Other people, that swollen, inflamed nodule or bump is always bothering you. And so we have to do some other tricks and step-by-step processes to get it under control. So right now you're probably wondering, well, what do I do for this? So my own step-by-step plan, which I love, everyone is now, hopefully you've already noticed, I kind of like plans and I kind of like step-by-step plans. I want to help you work through your injuries one at a time and making sure we're knocking everything out. So first, step by step, is we want to unload it and we want to watch what's irritating it. And with this area, when I say unload it, I'm not saying don't use it, but I'm saying make sure not to press it into anything that irritates it. So that may be your steering wheel of your car. That may be the handle of a suitcase or a drawer that you open. So definitely paying attention to the location of where it is, and then also making sure that when you use these tools, you can still use them, just make sure you're not pushing on the same spot. So when you go to grab things, grab just a little distally or just a little more proximal, more close to the palm to stay off of that nodule. So this is very much a unload locally, focally on that area and not so much stop using the finger. So I want you to unload it, and I also want you to watch what you're pushing on. So this is step one of just staying away from the bump, trying not to rub on it and irritate it. Try to leave that alone. So be very careful opening doors, carrying bags, doing any climbing on holds that press aggressively into this spot. If we can unweight it, the swelling is going to go down, and also the size of this nodule, right? So we want to get it from squishy, puffy down to very, very small, almost like a little pebble of sand, and hopefully you don't feel it. And when it gets down to that small, tiny size and is no longer tender and no longer irritating you, then you can go back to your normal activities. But if you're trying to get rid of that little tiny pebble with like scrapers or pokey finger rings or anything like that, it's not going to happen. You're just making it worse. So in this case, Stenosing Tenosynovitis or trigger finger, or these little nodule bumps, we do not rub on them. We don't grind on them with any tools, and we don't use any scrapers on them to try to get them to go away, because they will not go away. They're the result of friction and an inflammatory response. And if you create friction and inflammation by rubbing on them, they're just going to get worse. They're not going to get better. So this is a case where you're very careful with your self-care tools and making sure not to overly apply them. This is similar to the wave tool or the arete tool or a Graston tool. This is a gua sha tool. This is from, what is it, guashaorthopedics.com. You can also use a spoon, but any of these tools you want to stay away from with this injury. So you can climb on it, but I want you to climb when it doesn't hurt, and climb what doesn't hurt, okay? My most disliked holds with something like this are ones with sharp edges. There are also like the So Ill holds at the gym that are round with a little slit in them. I want you to stay away from those, of pushing right on that nodule on them. I would rather have you just move your fingers slightly. So if you're just climbing on tips because climbing on large jugs or that type of thing bothers it, totally fine. You're not going to make it worse. I just want you to stay off of mechanically loading that spot. And if you can do so while climbing, then you're absolutely free to go climb as much as you want. So try new holds. I want you to test, goal number 4 is trying new holds. So just to go back with my goals for you, goal number 1 is I want you to unload it and watch what you use it on, watch how you push on it. Goal number 2 is I want you to climb what doesn't hurt. Goal number 3 is I want you to try new holds and make sure that, because we try to avoid all holds when things bother us, that may be selling yourself short, and it may be that the holds that you're using are the ones that are exacerbating or irritating, and if you can skip those holds, then all of a sudden it's not bothering you anymore. It might be just merely overuse on specific holds. So let's try to add some spice to your climbing of rotating and trying new things. Number 4 is you can use an ice cube to gently massage over the area until it's numb. So we just take a small ice cube and holding it with a hand towel, we gently rub it onto the area until it's numb. So this is something we don't do for 15, 20 minutes. We just do it for a few minutes until that cold has numbed it up, and also when it gets cold, it squeezes all the fluid out of that area. And in this case, all the fluid is inflammatory, and so if we can squeeze the fluid out of that area, that's going to help give you less pain and also to shrink that bump in size. Now, when we start talking about wanting to get the swelling out of that area, I'm a big proponent of kinesio tape and compression taping. But in this specific situation of having a nodule or a bump or tenosynovitis, we don't want to put any compression over that nodule. Okay, so this goes on to my step number 5. I don't want you to tape it, okay? Keep tape off of that nodule, because tape, when applied, takes that nodule and it pushes it into tissue below it. In your case, we don't know if the nodule is superficial on the skin or if it's actually attached to the flexor tendon. Sometimes I see them between the flexor tendons. So if we put tape on it and we compress it, what we're doing is we're taking that nodule and we're grinding it into a nearby structure. Okay, so clients that I've seen that have taped this nodule and they've been climbing with it taped, they have a ton of more inflammation around that nodule, and I've also seen that nodule cause damage to tissues near it, because sometimes it's a calcium deposit, and in climbing fingers with flexor tendons rubbing and grinding against each other, when we start taking the space out of that area and really compressing them, when we have these nodules, it can really cause a problem, okay? So just keep in mind, and that tape puts weight onto this cyst, more friction and more inflammation will result. So we do not tape over it, okay? Number 5, do not tape. Number 6, massage, 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 but not on that spot, up in your forearms, okay? So hear me out. I did say if we apply any local pressure or rubbing on that area, it makes it worse. Absolutely. However, if we work upstream on the tissues that are contractile and load into that area, we can decrease the cause of why this is all happening, right? So if there's a lot of tension down into that tendon, it's under very high load. If we start to unload it by softening the forearm, getting that muscle to go from a contracted position to a lengthened out position, that is very beneficial. And I have seen a few different websites, climbing specific websites, stating that you cannot affect contracture and tightness in forearms by body work and massage. I've seen the very opposite with research. When we stick an ultrasound, MSK ultrasound onto there, musculoskeletal ultrasound, and we look pre-post, before body work and after body work. And I don't care if you're using a scraper, if you're using Icy Hot, if you're using a roller, if you're using your arm aid. What we see, and this is documented in literature with the company Rock Tape, is that, and you can watch it yourself, is that first that muscle is tight and not really moving. When you try to move it, it kind of looks like a bowl full of jelly. You're actually watching it on ultrasound. And then as we do foam roller or a massage or a vibrational tool, the brain is, what we think is happening is the brain is allowing that tissue to start moving normally again, and we can actually watch that tissue glide under the skin. So we don't know if we're affecting mechanically ripping up scar tissue. We don't know if we're telling the brain to ask that muscle to relax and glide. But what we do know is that applying any of these therapies will allow more motion of the muscle under the skin and will affect the tone all the way down in that fingertip to unload it to help that tendon to heal faster. So that's where I do like research. Let's talk surgery on these things, because when you get a bump, you wonder, is this something I manage? Is this something that I need surgery for? Surgery has been shown to help with cysts. However, if a cyst is attached to a pulley or your flexor tendon, if we try to surgically remove that cyst, we could structurally damage these important structures that we need for climbing, okay? So if a cyst is in the skin or connective tissue, we can cut it out, and sometimes it just comes back. So if we're just dealing with like a superficial cyst that lives there, I wouldn't worry about it, and I would just leave it alone. If you have a cyst living, like in the case of Stenosing Tenosynovitis, where you have a bump that is attached to your pulley or attached to your flexor tendon, I would absolutely not do surgery on it. You can have surgery on it. However, the surgeons I've talked to about my own specific bump that I have on my flexor tendon, I can kind of still feel it, but it doesn't bother me climbing, is that if they go cut that cyst out, it changes the strength of these tissues, and we really need them for climbing. So in my own situation with my cyst, my Stenosing Tenosynovitis, my nodule, unloading it, leaving it alone, letting it shrink back down. Now I can climb on it with no problem. However, we're now down to a management situation where we have to just keep an eye on how sharp of a hold we're pulling on, how much we slap to or vibrationally load into anything sharp or angular, because this setup is there and it's something we now manage that we cannot fix. So I hope that helps. If you love learning about this type of stuff, I hope you join me for my lecture that's coming up. Otherwise, if you know a friend that has this, please be interested or helpful in shooting this over to them so that they can also learn from it. My podcast and my YouTube videos grow only because you guys share them or like them. So if you did like this video, I hope that you do click like on it. I would like to learn more about your injuries and your traumas and the things you've been through. So I always love your notes that you put on the bottom of these things as for what you're going through. It helps me learn what you guys like, and I really appreciate your time. So make sure to pop out and see my podcast. It drops every single week at the same time, same place. And thanks for checking in with me. Bye.